it is the top of the hour, so let's get started. Hello and welcome. My name is Tracy Radke with Superior Health Quality Alliance. Thank you for joining the session 3 of our 5-part webinar series on organizational initiatives to prevent patient harm from opioids. Today's session and presentation will be community collaboration in opioid education and resources. This webinar is being recorded and attendees will receive a link to the slides, recording, and the quality improvement tool that will be reviewed later in today's session. If you have any question throughout today's presentation, please enter them in the chat. There will also be time for a Q&A at the end. Our agenda for today is to start with introductions, who we are, who is Superior Health Quality Alliance, an overview of the webinar series. We'll get into a great presentation today, go over the quality tool and next steps. So to start, we would love to learn about you. So if you would please enter your name, position, organization, which state you're from, and what is your favorite holiday and why? And you can begin doing that at any time. So who have we got registered? Well, we have 82 people across Michigan, Minnesota, and Wisconsin. And you can see the numbers on the screen. The facilities represented, 45 are hospital, 35 nursing homes, and 2 clinics. So we love seeing that combination coming together today. Here is the team that is involved in our webinar series. Dr. Bobby Redwood, who is a physician improvement advisor. We have Rachel Dibble, who also is an improvement advisor. Jenny Pritchett, myself, Yvonne Burston, who could not be present today, Candy Hansen. All of us are quality improvement advisors. And last, but certainly not least, is Michelle Norcross. She is the Hospital Quality Improvement Contractor Director. So this is a visual of what organizations make up Superior Health Quality Alliance. Well, we have through 3 QIOs. Improve from Michigan, Stratus Health is in Minnesota, and Metastar is in Wisconsin. There are 4 hospital associations representing Illinois, Michigan, Minnesota, and Wisconsin. Our final and 8th member organization is the Midwest Kidney Network, and they have facilities throughout North and South Dakota, Minnesota, Wisconsin, and Michigan. Here's a look at the webinar series schedule. Today we'll be hearing information on community collaboration. In October, we're going to talk about transitions in care for those on medications for opioid use disorder. And then in November, we'll review best practices in prescribing utilizing an opioid toolkit. Today's, or not today, but the series objectives out of all of our 5 webinars, our goal is to identify organizational opportunities that you can use to reduce harm caused by opioids. Describe alternatives to prescribing opioids to treat pain. Learn best practices in opioid prescribing and opioid stewardship. Describe the stigmatizing language and its impact on those seeking treatment for opioid use disorder. and to identify practices necessary to ensure safe transition for those taking medications for opioid use disorder. Expectations. So over the course of the webinar series, we encourage you to identify an improvement project or two, however many you wish, to utilize the quality improvement tools that are provided. Join our learning webinars, which are, of course, where you can ask questions live with the presenters. Participate on coaching calls that are 2 weeks following the webinar. To sign the personal pledge to shine a light on stigma, and to engage with your peers through Superior Health Connect. And next slide. And I'm going to give a huge plug that if you do nothing else today, please sign up for Superior Health Connect. It is the quickest way to get information on the webinar series. This includes links to the recording, slides, resources, and it is right here when you receive information later in the week. It will also include a link, but Candy is putting that link in chat as well. So please click on that to at least get it open in your browser. Next slide. So today's presentation is organizational initiatives to prevent patient harm from opioids. We are talking about community collaboration in opioid education and resources. We have 3 presenters today. Next slide. Wonderful presenters. First is Michelle Norcross, who is has an MSA degree. She's the Senior Director, Safety and Quality for MHA, Minnesota Hospital Association, Keystone Center, and HQIC Director of the contract for Superior Health Quality Alliance, and formerly was the Director of Safety and Quality at a mid-sized acute care hospital. She has many years' experience in program design, development, and implementation of statewide collaboratives and quality improvement offerings. Next is Mia Croyle, who is an MA in clinical mental health counseling. She is a behavioral health project specialist with Metastar and a subject matter expert with Superior Health Quality Alliance. She is a sought-after trainer in motivational interviewing and has trained thousands of professionals in this evidence-based communication style over the past 15 years. Our third and final presenter today is Jenny Pritchett. She is an RN and a BSN, also has a master's in public health and MBA. I call her the lady with the alphabet soup. If there's a program out there, she loves to learn new things, which makes her a great resource. She has over 28 years of healthcare experience. This includes hospital, clinic, and infection control, quality, medical center operations, and in public health. She's a quality improvement advisor with Superior Health. She is a former quality director, risk manager, and chief nursing officer and chief operating officer in acute care hospital. She is nationally board certified in infection prevention and control and is a certified professional in healthcare quality. She also has a Lean Six Sigma black belt. She has a passion for rural healthcare, especially in the areas of community and population health. So with that, I will turn it over to our first speaker, Michelle Norcross.
Thanks so much, Tracy. And I know that Jenny, me, and I are really thrilled to be here with all of you today and really excited to share with you all. So thanks for being here with us. Just going over some webinar objectives with you all. So today we're going to be describing some stigmatizing language and its impact on those who are seeking treatment for opioid use disorder. We're going to be describing naloxone availability and the use within community settings. And then we'll be identifying some best practices and resources in proper opioid drug disposal. And then we'll finally be identifying community support programs and resources to reduce stigma and eliminate patient harm from opioid use as well.
Michelle, you accidentally went on mute.
Oh, thanks for telling me, Mia. I don't even know how I managed that, but thank you. So let's talk about stigma, which is a huge problem, and why we should actually care about stigma. So caring about stigma is really related to opioid use disorder and in substance use disorder, and it's really crucial for several reasons. First and foremost, it's critical to care about this because treatment to access and effectiveness. So stigma can deter individuals from seeking help, leading to delayed or avoided treatment. It can reducing stigma actually encourages more people to seek care that they need, actually improving outcomes. So that's something that we want to do, is actually reduce that stigma so that they can go and seek the care that they need. For public health purposes, we want to address stigma because it helps prevent the spread of addiction. It supports public health initiatives. It can actually lead to more comprehensive and effective strategies for managing and reducing substance use disorders. For recovery and reintegration, individuals in recovery face less discrimination and have better chances of reintegrating into society when stigma is reduced. So this can actually lead to improved social and economic outcomes. For mental health purposes, stigma often intersects with mental health issues, exacerbating feelings of shame and isolation. So addressing stigma supports overall mental well-being and encourages a more compassionate approach for those that are struggling. And I would be remiss if I didn't add social justice. So tackling stigma actually aligns with broader efforts to address social inequalities and promote fairness. So we really want to recognize social use disorder as a health issue rather than a moral failing, which many people actually think that it is, and it's not. So in short, reducing stigma is essential for us to improve health outcomes, enhance quality of life, and actually foster a more supporting and equitable society. Next slide, please. So Superior Health was really excited to launch Shine a Light on Stigma, and there have been many efforts that have been going on for years to provide various forms of assistance to those with substance use disorders, between screening instruments, workflows, medications. Many have identified patients in need of treatment and they've provided them with care that they needed. They've attempted to increase availability of treatment. There have been addition of peer recovery coaches, peer support groups, helping patients to navigate care. And despite some of these technical changes and improvements, only about 1 in 10 people actually receive treatment that have substance use disorder. And as we've discussed, one of the primary barriers to receiving treatment has to do with stigma around, substance use disorders. And so many patients that have a substance use disorder feel shamed or judged due to that stigma, which results in doubts that they can or will receive the treatment that they need. And I think if any of us kind of can imagine what that would feel like if we put ourselves in their shoes, if you could put yourself going into the emergency room, and do you feel that you would be treated with dignity and respect if you went in, or do you feel that you would be treated with shame? And, a central strategy to addressing stigma is becoming more aware of how the words and language that we use can impact others and impact their feelings. And subsequently, our actions towards others do impact them. And so how we address others and how we address and utilize our words really does matter. And so to this end, again, Superior Health has launched a Shine a Light on Stigma campaign. And this campaign asks both organizations as well as individuals to sign a pledge to use non-stigmatizing language around substance use disorders. And so when we see each other as being more than similar than different, we're able to reach out and connect in ways that are more supportive and helpful. And so the Shine a Light on Stigma, next slide, please, really will help bridge that gap. And so I want to pause for a moment, and I'm going to ask you to do something that many speakers will never ask you to do, and that's get out your phones. And I'm going to ask you to get your phone out and put on the photo mode and scan that QR code, or you can click on the link that Candy just put into the chat to actually go to the Shine a Light on Stigma. And I'm going to give you a moment to just take that pledge, because the Shine a Light on Stigma campaign, again, allows individuals to take that pledge to use non-stigmatizing language. And we're going to ask you to take that pledge today to learn about stigma by listening to the stories of people that have lived experience. And you can share this website. There are a ton of resources. We're going to talk about some of them today. There's media toolkits, and there's a lot of really great resources that can help you change your narrative today. Again, because substance use disorder is not a moral failing, and we need to help change that narrative. So a central strategy to help address stigma is to become more aware of how, again, these words and language we use impact feelings and subsequently our actions in regards to addressing this issue. So using non-stigmatizing language is really important, especially as a caregiver, because it promotes dignity and respect. It encourages engagement. It reduces barriers to care. It promotes better outcomes. And further, it promotes a professional standard. So using this non-stigmatizing language really fosters a supportive environment that enhances care, both for quality and high quality patient outcomes. So again, I really encourage you to sign that pledge today and join us in changing the narrative and shining that light on stigma. Next slide. So you're going to see that we have across the nation 19 different states that have already helped to sign this pledge. We have over 188 different pledges that have been signed, and we're hoping that you can be part of this, because again, ending stigma is about preventing the judgment and shame imposed upon people with substance use disorder. So we can help to create an environment that promotes healing and recovery in a supportive and a respectful way. The words we use directly influence our thoughts and feelings about others, and we can really help to eliminate stigma again by just adjusting how we talk about it with one another and with each other. So again, by shining a light on stigma, you're making a conscious decision on thinking about your words and choosing person-centered language. So that's going to shift and elevate the person and help to eliminate the discrimination and that stigma that's been created. So we really hope that you're going to join others who have signed the pledge and again, help shine that light on stigma with us. So just as some examples on the next slide, people with substance use disorder who have a medical condition and they need medical care. And so yet the language we use often describe people with substance use disorders tend to blame and demean them, creating that stigma that often interferes with their opportunity to seek treatment. And so eliminating that stigma again is one of the first steps we can actually take to help them access the medical care that they need. So shifting that language is important because it respects individuality. It focuses on the individual instead of the condition. It emphasizes their identity and experiences beyond their disorder, fostering that respect and dignity. It reduces stigma by using non-stigmatizing person-centered language. Healthcare professionals can help to challenge and reduce the stigma associated with substance use disorder, and it can encourage individuals to seek help and engage in treatment without the fear of judgment. It promotes positive relationships. It fosters an empathetic and supportive relationship between healthcare providers and patients, and it can improve communication and trust, which we know is essential for effective care. It supports recovery. When individuals are addressed with respect and understanding, they're more likely to feel empowered and motivated in their recovery journey. And this approach can actually lead to better adherence to treatment plans and more successful outcomes. It enhances care quality. Person-centered language aligns with best practices in healthcare, emphasizing a holistic approach to care that considers the whole person rather than focusing solely on the disorder. And it encourages empowerment. So using person-centered language helps individuals feel valued and in control of their own care, which is crucial for motivation and self-efficacy in managing their own health. So again, we have multiple websites and resources that you can utilize to help you determine how to move forward. There's several examples that are here on the screen that you can look at because again, substance use disorders are not a moral failing, but if you start utilizing language, calling people addicts instead of a person with substance use disorder, you can see how that narrative really is telling them a story of how you feel about them as a person instead of about their condition. Next slide, please. So I want to switch gears and talk a little bit about a peer recovery coach who's an individual who has lived experience with substance use disorders and recovery. And their role is really to support others who are on a similar path to recovery. They offer support and guidance, and they really help clients navigate challenges and stay motivated. They use their own lived experiences to connect with clients, offering insights and hope from their own recovery story, and help with goal setting in working towards personal recovery goals, whether related to recovery, employment, or even personal growth. They help their clients with community resources such as treatment programs, support groups, and social services, and they help access those resources for their clients. And they advocate for the needs of their clients, such as healthcare and even legal services as needed, so that they're receiving appropriate support. They provide strategies and tools to help clients prevent relapse and manage triggers effectively. And peer recovery coaches are amazing resources to assist with shining a light on stigma and moving again towards person-centered language. As they focus on empowerment and respect, as we've discussed, they help to build trust. They create personalization of support. They reduce stigma, and it demonstrates that you want to reduce stigma by having them as part of your team. And they really work to foster collaboration because that emphasizes collaboration between the coach and the individual. It encourages a partnership where the individual's preferences, strengths, and goals are central to that recovery strategy. Next slide, please. So I did include some benefits of peer recovery coaches as well. And these are specific statistics included from Michigan hospitals that are currently utilizing peer recovery coaches within their organizations. And peer recovery coaches have success connecting 65 to 75% of patients with outcome treatment and supportive services upon hospital discharge. I just want to note that that is in stark contrast to a 2022 study that revealed only 11% of those with opioid use disorder patients specifically that presented to the emergency department that were referred to outpatient treatment. So 65 to 75% as compared to 11%. That's really outstanding results. Patients who have increased retention to treatment programs and access to support services. Hospitals who offer peer recovery coaches services report uptake of 87 to 89% of eligible patients. They've received strong positive feedback about the experience, which is really phenomenal feedback. Those that have peer recovery coaches are less likely to be readmitted within 30 days as compared to their peers who are eligible but do not accept these services. Those that work with peer recovery coaches are less likely to utilize emergency department services. And there's also mounting evidence to support the role of peer recovery services and coaches have decreased criminal justice involvement. So the bottom line is that peer recovery coaches are effective as well. So I'm now going to pass it off to Mia, who's going to share some additional resources on the Shine a Light on Stigma campaign and website. So Mia?
Yeah, so one of the on the Shine a Light on Stigma website, you'll see sort of resources toward our multi-pronged approach at addressing stigma. And so, as Michelle did such a great job highlighting our person-centered language and the push to use person-first and person-centered language around individuals with substance use disorder. Another prong of our approach to reducing stigma is listening to the stories of people who've been impacted by substance use disorder or by substances. And so you'll see we have a storytelling series on the website. And I wanted to share a brief excerpt from one of the stories that is contained on that website. These are just stories we've collected from what's available publicly through video, written stories, etc. So I'm gonna ask to play this, and she'll tell you her story.
I'm Justin Phillips, and I'm the founder and executive director of Overdose Lifeline. Stigma is an important topic for me and part of our platform at Overdose Lifeline because I think it completely interferes with a person's ability to seek help and the family's ability to seek help for their loved one. I believe that the denial comes directly from the stigma that we perceive in society. So when I think about Aaron, my son, who overdosed on heroin in October of 2013, and his first asking for help and his first admittance to me that he was using heroin and could not stop on his own, I didn't take off work. I didn't share with my fellow employees that my child had a disease that could kill him. We don't treat the chronic disease of addiction the way we treat other chronic diseases. So I knew that if I went to work and shared with my coworkers, which is part of our family, I mean, we spend a lot of our life with people that we work with, that Aaron was using heroin, there would be shock, dismay, judgment. I wasn't going to do it. I let someone else take Aaron to treatment rather than me going myself. If he had had cancer, of course I would have gone with him to the doctor, to the hospital. This is how we treat the disease because it's a stigma that we believe it's never going to happen to us, that something must be fundamentally wrong with you if you have this disease, that you, yourself, your character, your person have done something to bring this upon yourself, that you are flawed. As humans, we judge each other. We don't see it as a disease. We never see it as a disease. If we treat it like a disease, I can come to you and share. My son, has found himself addicted to heroin. I got to go get him the best treatment I can find. That's what I would do for another disease. We rally around a family if they lose a loved one or they have a loved one sick with a chronic disease, and we never take casseroles to families with substance use disorder. We don't treat those families in the same way we treat families with other chronic diseases. I'm sure if we looked at emergency medical.
So there's more, and you can, Candy put in the chat the link to the entire video, so you can certainly view the rest of that at your leisure. I find that, as a parent, I find that, the way she frames the issue and tells her story to be pretty striking. And, it's easy to sort of wrap your hands around the impact of stigma when you think about this idea that we don't bring casseroles over when a loved one in a family has a substance use disorder. So I hope that video was a little illustration of just how powerful it can be to directly hear people's stories. One of the things that happens is that although many times we can identify people in our own life who might have substance use disorder, everyone has been touched by this, but we tend to not be in close proximity with those individuals. And so we don't hear their stories. And there are other ways to get close to individuals with substance use disorder. And hear their stories and see their humanity playing out in front of you. But these videos and the written stories that we have are a good starting point. And so that's why we populated this series with those on our website. Jenny, go to the next slide. And one of the other things that I think is important as a community that wants to be not stigmatizing is making sure that we have made naloxone available. So naloxone is a medication that can rescue someone suffering from an opioid overdose. So it rapidly reverses that overdose. And the way it works at a really high level is that it attaches to those receptors in the brain that opioids would be attached to. It sort of knocks them out and attaches itself. And then that can reverse and block the effects of the opioids. So what happens in an opioid overdose, what people are actually, the symptoms that they're actually having is that their breathing slows and that it can actually stop or slow to other dangerous levels. So this is a way to stop that process. It's highly effective if someone has opioids in their system. And if someone doesn't have opioids in their system, naloxone is safe and it has no effect on a person. So, in sort of a emergency situation, if you come upon someone who is unconscious and not breathing, and you don't know whether they've used opioids or not, giving them a dose of naloxone will not harm them. And they just won't respond to it. Next slide. So currently naloxone comes in 3 approved forms. There's the injectable, there's sort of these pre-filled auto injectors, and then there's the prepackaged nasal spray. And you'll see there's the image of the nasal spray there. That tends to be the most popular for community distribution. It's very easy to administer. I always say if you can do a nasal spray, for stuffy nose or allergies, you can do this because it really is the exact same way of applying it. You put it in the nose, you push the plunger, and it dispenses itself. The other forms tend to be more used with EMS or other settings where there's sort of a little bit of medical know-how. You can go to the next slide. So ways that naloxone has been distributed. These are all lists of places. And as you can see, some communities get pretty creative in terms of having them in food pantries, libraries. One of the new models is having them in vending machines. The vending machine doesn't cost any money, but often it might ask you to input your zip code just for data purposes. And then it will dispense a dose of naloxone, one of the little naloxone doses that you can carry with you. Naloxone training is available in lots of places. It really can be as short as a 5-minute training. There's short videos of naloxone trainings available in lots of places. I will tell you that, one of the places that you can fairly reliably see stigma rearing its ugly head is in conversations about naloxone, about overdoses, in those public forums where things like to rear their ugly heads, like on social media, on the websites of newspaper articles, those kinds of things. And, unfortunately, sort of trigger warning for people who might be susceptible to really ugly triggering language. People say, well, overdoses are just a way of thinning the herd. We shouldn't try to reverse overdoses. What are we spending our money on this for, et cetera, et cetera. However, luckily, that's not been the prevailing thought. So a couple, real benefits to opioid rescue medication is that often an overdose, when someone has been rescued, it's an actionable moment. It might be an aha moment for that individual. And if we are poised and ready to have conversations with them about options for treatment, sometimes that's a moment in time when their readiness is a little more open than other times to seek treatment. Also, just at a basic humanitarian level, everyone who overdoses is somebody's child. Everyone who overdoses is somebody's beloved person. And you can't do anything if you're not alive. You can't recover. You can't go into treatment. You can't turn your life around. You can't apologize. You can't give closure to people. So none of those things can happen if the individual isn't alive. So there's a strong argument, and luckily lots of places in the community are listening to that argument. One of the other things that is important to note if you are in a healthcare facility is that giving people a prescription for naloxone, which was one of our initial sort of strategies, can be helpful. It's more helpful than nothing. But, that added step of going and filling that prescription, and the fact that you don't actually need a prescription for naloxone anymore, but even giving a patient instructions or directions to go obtain naloxone, and you can get it at your nearest pharmacy, et cetera, is nowhere near as effective as putting naloxone in their hand in that moment. So there are risk factors that would, sort of be a clear algorithm for who should get naloxone. Or you could think about, the idea of a universal precaution, and you offer naloxone to everyone. You can go to the next slide, Jenny. And so how can you obtain naloxone? It's available, like I said, without an individual prescription. You can obtain it at most pharmacies, although you probably might need to pay out of pocket for it because it's now considered an over-the-counter that's available without a prescription. Your insurance may or may not cover it. And then there is a link here for harm reduction resources near you with the National Harm Reduction Coalition, and they have some listings. And then if you go to the next slide, Jenny, this slide, and I think Candy already put that in the chat, but specifically each state does have places where you can find naloxone. There are some programs where naloxone can be shipped to you at no cost. Those tend to be, they ask that those be reserved for people who with substance use disorders or who use opioids, but not exclusively. So if you're interested in carrying naloxone, it really feels like it's the public health challenge of our time. There was a time and when the big push was get everybody to learn CPR. And we've done a great job of that. And then it was, get AED devices in lots of places. And we've made a lot of headway in that. And so it feels like the next thing is, naloxone distribution, and how can we saturate our communities with naloxone so that we're protected against the opioids that are saturating our community, unfortunately. Next slide. And now I am going to hand it over to Jenny, who's going to talk a little bit about how do we desaturate our communities from these opioids.
Yeah, so thank you, Mia. Thank you, Michelle. Your presentations were wonderful. So yes, I'm going to talk about how we get these medications out of the hands of those who they're not prescribed to and off the streets. So the DEA prescription drug take back program. So actually, there's also a drug take back day, and we'll be sharing these links as well in the chat. The next event on a national level is October 26th. And so it's 10 a.m. to 2 p.m. Local time, wherever you may be, whatever time zone you may be in. And so what this is that, you know, it's just a campaign, and it's very much focused on community and how to get these drugs off of the street and where that you can dispose of them. So on the DEA prescription drug take back website, there is a collection site locator. And so that will tell you, if you put in your zip code and where you are from, where the collection sites are, and this is on a national level. And then I will be talking later in the presentation about just the websites that Michigan, Wisconsin, and Minnesota also have for collection sites as well. And the DEA is definitely committed to making communities safer, and this is how they are doing that. And they also are doing their part to further reduce drug-related violence as well. And we also want to note that this month of September is also National Recovery Month. So please celebrate that also, personally, professionally, within your organizations. Also, I do want to note, within your healthcare organizations, please promote this DEA, the drug take back day, because it is very important that staff also know this. Share it on your social media sites. When you go on to this website, there's social media toolkits and infographics, and you can promote that within your healthcare organizations as well. So for Wisconsin, Wisconsin has a website called Dose of Reality, and you can put in your location, and you can find out where the drop boxes are for the state of Wisconsin. And this is sponsored by the Department of Health Services. And as you can see, Wisconsin has several locations for drop boxes and proper disposal instructions throughout the entire state. So I think Candy will be putting the links to these as well. And then following the presentation, we'll be sharing these slides as well. So you'll be getting the links following the presentation too. Michigan, as you can see, also has several collection site locations. So the Michigan Department of Environment and Great Lakes and Energy sponsors this site. And you can also put in the location for the state of Michigan to find proper disposal as well. And then in Minnesota, you can tell that they have multiple, that is almost basically covering the entire state. And you can take the take back events, also is called Dose of Reality for Minnesota, similar to Wisconsin. And they'll have many resources available if you go on that website for collection and other resources as well for safe disposal. And I also want to make note, within your healthcare organizations, all of you should have policies on proper disposal as well. Each state is a little different as far as the DNR. Years ago, we used to flush them down the toilet or put things down the sink, and that is no longer an appropriate way to dispose of medications due to it does contaminate the water sources. So make sure you follow your internal policies on proper drug disposal as well, and that you're following your organization's drug disposal policy. And then through Superior Health, and we will be sharing all of these resources, so you don't need to jot them down. We have several on our website. We have the communication strategies to reduce stigma. Frontline Forces is another program through Superior Health on responding to opioid overdoses and substance use disorders. We also have a naloxone Saves Lives flyer that you can share within your organizations and within your communities. Toolkits for opioid prescribing and overdose prevention. As Michelle had shared earlier in the presentation, we have the person-centered language and all of those appropriate resources as well that you can share within your organizations. We also have the flyer to the Shine a Light on Stigma that you can share, and the Words Matter series. So all of these, you can brand them within your organizations, you can share them on your social media sites and educate your communities on reducing the stigma of opioids and making sure that we get them off the streets. All right, so I'm going to open the floor here for any questions for Michelle, Mia, or myself. You can either unmute yourself and ask the questions, or you may also put them in the chat. Candy will be watching the chat for us if there are any questions. Candy, do we see any in the chat thus far?
Nope, I do not see any in the chat. There maybe was one very early on. Oh, there was a question about how are peer recovery coaches reimbursed? And I think Michelle responded, that's a great question. It's currently state dependent. In Michigan, they're a billable service through community health CMHs. Sorry, Michelle. But it was also recently included in the governor's budgets for hospitals to be able to bill.
Wonderful. Okay, thank you. Okay, well,
I will say in Wisconsin, they are primarily funded by grants at this point.
okay, thank you,
We
Mia.
don't have reimbursement for that yet.
Okay, thank you, Mia. Anyone else? And if you think of questions, even throughout the rest of the presentation, just put them in the chat and we'll be happy to answer those for you. Or, if you think of questions, we will have our contact information at the end of this presentation so that you can reach out to any of us at any time with questions. So next, I will be reviewing the next quality tool, which will be the action planning. And so with webinar 1, we had the overview of the charter. And then during webinar 2, we went over the desired performance statement. And now webinar 3, we'll be reviewing the next steps, which will be the quality plan. And so I do have a screenshot here of the quality action plan, but I'm going to actually bring up the template that we have for Superior Health. Let me stop sharing just for a moment to get that up. And we have a template that we will be sharing with you all in the follow-up email. I'll show you this here today. And let me know if you can't see it, please let me know, but I think I have it up here. So for Superior Health, we have an actual template that we'll be sending out, which is the Quality Improvement Action Plan. So for the action plan, and this was the same as the screenshot that I had, but this would be a fillable action plan. And we do have, as you can see, just some examples so that you know how, as an example so that you know how to put this together. And so with the quality plan, you want to put your evidence-based interventions. So basically what this does is it outlines the steps and strategies to achieve your specific goals within your organizations. You also want to specify your objectives, identify the problem. This also helps in prioritizing the process improvement initiatives that you want to do within your organization. And it also gives you timelines and who is responsible for these timelines and for these roles and responsibilities. And so you definitely want to clearly state your SMART goal. So what we have as an example here is the ED staff will utilize Alto. order set of treatments for migraines 80% of the time by February 28th of 2025. And most of you are in the quality profession. So most of you have already done a quality action plan or a SMART goal, but many of your team members may have not. And I know a lot of you may have team members and maybe directors of your clinical areas or their staff, frontline staff doing some of these initiatives. So this is very helpful in helping them, making sure that they follow a timeline and that they will accomplish their goals. So as you can see here, the different steps to accomplish, who is responsible, the start date, the due date, and results and issues addressed. Because as we know, in every healthcare organization, there's going to be some barriers. So it's very important to try to identify these barriers from the beginning so that they can be mitigated for the most part. And you want to make your goals realistic. You can make very small goals and build upon them, and to make sure that your barriers, if there are barriers identified, what can you do to try to, build upon those goals so that you can reduce those barriers. And then we also have within the template, the outcomes table reporting. So what this is you can put in your measure description and your goal, which is 80%, 90%, 75%. What is your baseline? And then your different measures. You also have a spot here for describing your plan for sustainability, because obviously you want to make sure that your plan is sustainable and how you want to build that within your plan. And even, so this is sustainable even long after the completion of the project. And also with this, it's just important to note that, this is fluid. You may have, it's not set in stone. Your goals may change. Your, the percentages may change as time goes on. You may have changes within your organization, changes in leadership, changes in initiatives, changes in policies. So this is a fluid plan. It can be changed. You can be adjusted. As we all know, if we use the PDSA model, you can adjust, you can adapt, you can abandon, and making sure that you're updating this plan as things evolve. So we will be sending in the follow-up email this template for you as well. So any questions for me on the quality action plan? Or any one of the team members want to add anything that I may have forgotten? Okay, let me get the presentation back up here.
There are no questions in the chat box.
Okay, thank you, Candy.
Mhm.
Let's see here. I'm going to bring this up.
I just want to say, as I think about all the information we presented and probably all the information that you're getting over this 5-part series, I'm overwhelmed. And so, this isn't something that has to be tackled in one step. This is definitely, think about what might be easiest for your organization, your team. And maybe start there so you can get an easy win. Or you might think about, what's the most urgent that we address and start there. But you don't have to do all of it right away. This is a sort of a long-term thing. And addressing stigma and changing that attitude, it's really a culture shift, and that takes a long time. It takes repeated exposure to the information, and it in some ways, someone I talked to made the point that really, like, changing stigma is an inside job. Like, it's a lot of head work and heart work for each individual person. So, if I could leave you with one thing, it's just grace. Give yourself oodles of grace as you're working on this. Give your teams oodles of grace. And and think about, sort of promoting these changes with the idea of grace. We're not expecting perfection, but every time you make a subtle shift in your language, that makes an impact. And the times you forget, okay, well, we're still learning. So thinking about, we can't come in and be self-righteous about all of these things. We want to get there, but we recognize that it's going to take a lot of time and a lot of effort. And the more people we can have sort of walking down that road with us, the better we'll be. So we invite you to join us. We invite you to take the pledge. We invite you to explore what's most interesting to you.
Absolutely great. Yeah, because this is a culture shift. That could take years, culture shift. So grace is
Decades.
the
Yeah.
most wonderful thing that we can leave you with. So thank you so much, Mia. That's excellent. Start small. Start very small. So our next coaching call is going to be on September 24th, and the link is below, and we will also send that out to you as well. And as always, your feedback is very appreciated. We value your feedback, and we will be sending that link to you as well. And I believe that will be in the chat as well too. And in the next series, we are very excited to have Tracy Radke, Rachel Dibble, and Candy Hansen presenting session 4, which is transitions in care for those taking medications for opioid use disorder. And that is scheduled for October 8th. So please register for that if you have not done so already. We're very excited for the next in our series. And as we stated in the beginning, please sign up for Superior Health Connect. You'll also get all of these resources in that venue as well. And take the pledge if you have not done so already. And I'll give you a second if you haven't captured the QR code, do that now. And that's also in the chat is the link. And encourage your friends and family also to do this as well. So our contact information is listed here. And if you think of any questions for us at any time, please send us an email and we'll be happy to assist you. Or, if you're having difficulties within your organizations of just, moving the needle, if there's anything that we can do to help, please contact us and we can give some one-on-one help as well. Okay, any questions before we conclude? All right. Well, if there are none, thank you, everyone, and have a great rest of your afternoon.